My name's Damian McHugh. I'm the Chief Marketing Officer at our Momentum Health business. Today we're hosting a lot of media and then hopefully some influencers around the concept of health and well-being. We think it's important for consumers to start to understand the link between health as an asset, their own health as being an asset, and the importance of managing and protecting that asset over lifetime. Up until now, we've only really been focusing on the physical well-being of individuals, and mental well-being is a massive part of that. So our program not only rewards and incentivizes the physical activity, it's also measuring how well are you mentally well. Have you rested well? Have you recouped well? So if you are recharging properly, your overall ability to meet the day's requirements and your family's requirements will be stronger. And Multiply is the only program that we're aware of, not just in South Africa, but in the world, that is not just measuring physical well-being, but also mental well-being and more total health or complete health. The rise of the digital age has impacted life in general. And as a result of that, it's obviously impacted healthcare. So what we've seen in South Africa's healthcare, what we call the healthcare industry, is medical schemes and health insurance. It's quite legislated, and it's difficult often to innovate there. So the adoption of digitization enables us to start looking at healthcare differently. The products we design, how we design them and for whom, who the customer actually is, and the uniqueness of that customer, how can you design for them. But the digitization of service, the digital self-service, the way in which we claim, the speed of which we do those things, I think is enabled through technology, but also how you consume healthcare information. So I think the digitization in the South African context is one that gives us consumers access to information sooner, gives them the ability to consume that information better and make it more personalized for their individual journey. Then I think we're delivering a better health knowledge, and then we can help better with the health outcome based upon those principles.
My name is Márcia Eugénio. I'm head of Momentum Multiply for Momentum Health Solutions. Momentum Multiply is really a health behavioral program. We incentivize healthy choices. The healthier you are, the greater the benefits. And our intent with this program is really to build healthy habits and to reward our members for building those healthy habits. We've tailored the program to meet the diverse needs of users based on where they are at on their journey. So we know that when it comes to eating good nutrition, sleeping well, managing your relationships, managing your stress, that applies to everybody. And so what we really try to do to tailor it for your specific needs, we give you the choice of where you want to start on your journey. So if it's nutrition you want to start on, then that's how we interact with you. Momentum does have plans to create more access for more health. I think technology and digitalization helps us do that. Traditionally, we've always had to get a nurse to get in their car, to see our members. And so with technology, we're able to give anybody with access to a smartphone access to this program. So whilst our plans are there in creating that access, the plan or the focus is creating awareness that allows our members to take responsibility for their health, and in doing so they actually lower their risks for many different types of diseases. And because behaviors are difficult to change, we model incentives drawing on behavioral science like psychology, like social health, to really create awareness, helping people and nudge them to make the right or take the right steps in improving their health, and then using incentives and rewards to reinforce that message. So we do that all through digitalization, and we're doing it through digitalization to improve access, but also to make it attractive for the young and healthy, because we're really trying to create a culture of well-being and moving away from a culture of treating disease.